would love to hear the corollary in India where the India national healthcare system is focused.
For a country as large and as diverse as India, there are national programs run by the central government. The largest insurance scheme of the world was launched in India, the PMJAY, which covers 500 million people. We also launched the National Digital Health Mission, which covers 825 million health IDs have been generated till now. We created the world's largest telemedicine platform. Think about India, 1.4 billion people, scattered around 700 districts in the country, 35 states, union territories, a mix of public and private, and traditional thing. Insurance still is with some 500, 600 million people. That's all out of pocket. It's at a very interesting vantage point.
Welcome to the Analyzing Healthcare podcast brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. All right, welcome to the next episode of Analyzing Healthcare by Scale Community. I have the pleasure of being joined today by Dr. Rajendra Pratap Gupta. Welcome to the podcast.
Thanks for having me, Jason.
So, Dr. Gupta, you bring quite an illustrious career based in India, but you've really worked both within the Indian healthcare market and globally. I'm looking here a few examples, and there's way too many to list, but you've been the chairman of the Dynamic Coalition on Digital Health for the United Nations Internet Governance Forum. At the World Health Organization, you've been a member of the Guidelines Development Group, and you've been an advisor to the Indian national government on healthcare policy, playing a key role in various documents and policies that have been adopted over the past 10 to 15 years. So really broad and deep experience, again, within India and unique exposure to the global healthcare market. So with that, and I probably missed a bunch of other experience that you can point to throughout the conversation, but I'm really looking forward to digging into all these topics. So maybe let's begin with India, and then we'll sort of zoom out globally and cover it in that sequence. So I like to begin with these podcasts with international guests by just getting a quick overview of the healthcare market in your country. And I know that's a lot to do in a short amount of time, but how is the healthcare market structured, public, private? And then what are the key trends and areas of focus that the country is focused on nationally? Here in the US, we're very focused on cost of care. There's been a trend of consolidation, particularly in the non-hospital market. The theme of value-based care is something that we continue to evolve, develop, understand, and discuss. So those are a couple of the themes that we're focused on in the US, and would love to hear the corollary in India where the India national healthcare system is focused.
Thank you, Jason. I think it's a very interesting question, and for a country as large and as diverse as India. So you have to understand the market from various standpoints. So health is still a provincial or a state subject. So just imagine 35, 36 states, union territories in India. They have the final say of health systems, where the national health policy is from the central government. There are national programs run by the central government, but it's a mixed system. On one side, we have private sectors, which is almost little more than half now. It used to be 80% of healthcare at one point in time. There is a public health system, and there is also another angle to look at Indian health system. So one side we have the modern medicine, is allopathic treatment, but other side we have Ayurveda, which is like 10,000-year-old science. So people use a mix of systems. So it is very interesting to see how India has evolved over time and how it is going. Last, I would say 7-8 years under Prime Minister Modi for healthcare at least has been very, very, I would say disruptive. The largest insurance scheme of the world was launched in India, the PMJAY, which covers 500 million people. We also launched the National Digital Health Mission, which covers 825 million health IDs have been generated till now. We created the world's largest telemedicine platform. That's done almost like 425 million teleconsultations that I was looking at the data today. We did almost 300,000 consultations today. So look back and think about India. 1.4 billion people scattered around 700 districts in the country, 35 states, union territories, a mix of public and private, and traditional thing. Insurance still is with some 500, 600 million people. That's all out of pocket. It's at a very interesting vantage point, as I would call it,
Well, a
with the
couple of
government.
questions. Just hearing that. So the traditional medicine, homeopathic, and Ayurveda, is that how you say?
Ayurveda, yoga. Yes. So,
Are they covered
Jason,
by insurance, or are those would all be outside of the insurance?
no, this is outside of the insurance, but I'll tell you a very interesting part of it. I mean,
Mhm.
most people don't understand this. Today the world is looking at longevity to achieve of 80 years, 70 years. But around 4th BC, that is like 2,400 years back in the Upanishads, if you go back, the scriptures, they divided the age, Indians' age into 100 years, 100 years each into 25 years. Look at how scientific it was. First 25 years, the student life where you gain knowledge. The second 25 years for family. Third 25 years is, resigning back from active life and get disengaged. And the last year was renunciation. So that means that people lived 100 years to divide the life into 4 phases.
Mm.
And we talk of genomics today. Of course, I will not say the word was genomics, but Ayurveda as a system divides the body into 3 types and treats them based on them. You cannot get treated simply if you go to an Ayurvedic Vaidya, as they call the physician, by saying, hey, look, I have fever, can you treat me? He will go for your body type. So it is Vaka, Pitta, Kapha, 3 kinds. He will treat you based on what body build you are. So it's a very scientific treatment. And today, when people ask about how things are going, the yoga, I think it has scientifically proven of how it helps manage people's various chronic diseases, going to the root cause, not just symptoms. So I'm very excited at the integration which the government is attempting now is to integrate Ayurveda and allopathy. So that's a very interesting
So maybe
build of
coming more
India's health.
into the mainstream market.
Yes.
Interestingly, you mentioned that the private market, it sounds like, has gone down as a share of total insurance from, call it, roughly 80% to somewhere closer to 50%, maybe a little higher. What's driving that decline in the private sector market?
The first is that, government changed the definition of primary care. When I authored the National Health Policy in 2017, we decided to provide comprehensive primary care in chronic diseases. So the very concept of how government delivers primary care was redefined. The number of health and wellness centers that was envisioned that we would set up has gone to 170,000, way more than what was existing at that point in time. So government facilities have got upgraded. There is a huge investment coming in. But at the same time, India is a big market. So we have private sector also growing at a frantic pace, I think in good double digits.
So
And they will
both
continue
markets
to
are
grow.
growing, but there really was, it
Both.
sounds like, an investment in the offering, the
Yes.
public insurance offering, to make it much better, both chronic care and just number and quality of facilities across the country, and
Yeah,
probably a
that's
much
true.
cheaper option. So as that improved, that became just a favored product by the
So
consumer.
I would not say favored because there is a reason. Still there is a lot of, I would say, for some sections of society, trust in private because it is hassle free. It's not, paid for by anyone. So you pay, you get an appointment immediately, you get a procedure done.
Yeah.
It's a very high quality care. I mean, in India, you get the quality as good as United States. A lot of patients from abroad come to India for treatment. So those people who have the money, they will go to private sector, get it treated. And as the earnings are rising, as the middle class is growing, they are increasingly shifting towards private to get a treatment they want.
I mean,
And that's where,
it's not that different than the States, really, right? Like, we have 50%, the 50-50 government, whether it's Medicare or Medicaid versus commercial, it's about the same ratio. And, typically if you're above 65, you're going through either a, government or managed Medicare plan. And if you're in the lower income category or a couple other categories, you're going to Medicaid. If you're in middle class employment, you're typically going to your employer to get commercial insurance. Is that also how insurance is being consumed in India? That it's the senior population that's going to the government and the lower income that's going to the government, with the rest going through employers? Or is it a different demographic breakdown of public versus private in India?
so as a system, it is same. But if you look at the minutiae of this, the government insurance have also empaneled private sector. So I'll tell you the reason that was done. Our belief was that if we invest huge amount of money in building hospitals, we would consume our budgets. It makes more sense for me to pay for the procedures in private sector and get people the care they need. I mean, if I go to build all across the country hospitals, I would just finish my budget in few years. But if I use the amount of money very strategically called the strategic purchasing from private sector, I could give the money through insurance to private sector. So that's where I think insurance still remains the same, but people may end up buying from private sector, which is empaneled facilities. So you will also see private sector growing pretty fast.
Other concepts that we see in the States and have seen in the States, and I'm wondering how relevant they are in India. So, number one, migration of procedures from higher cost hospital environments to lower cost outpatient ambulatory surgery centers. So, cardiology is a good example where lots of surgical procedures in cardiology have been approved to be moved to the ASC, ambulatory surgery center environment. Prior to that, a lot in the ortho MSK space was moved. Are you seeing that type of a trend in India where cases are being moved from high cost environments to more efficient, lower cost environments, or is that not really a focus in India today?
So government has got its rate. When we started this largest insurance scheme, there was a rate card decided. And I'll tell you why India is a little different. So if you take out the major metros, a large part of the population lives in smaller towns and villages. So the best thing that has happened through government insurance is the growth of private sector in these smaller cities. Because I talk to these people, 50% of their revenue is coming from government insurance. So while the rates are not very high, the government has been careful not to overprice the rates. They've been priced low, but the volume is very high. So I think it's a different model, but the same approach. There is an insurance. It is priced reasonably okay, not so profit. Some procedures you make money, some you lose, but eventually it balances out. That's the practicality of where we stand today. But I think the government insurance is going to lead to huge growth of healthcare facilities in smaller towns, which was not thinkable in the past.
Understood. Another trend we've seen in the States is consolidation, both in the hospital market and in the non hospital market. But more recently, the non hospital market has been driven, consolidation has been driven by private equity investments. My understanding, although I'm not that deep in the India market, is that India too has seen proliferation of private equity investments in the hospital space as well as in some specialty spaces, fertility, nephrology. I'm just curious if you can give an overview of what role consolidation has played in the India market and what role private investment has played in that consolidation trend.
So I would start by saying, sadly, that's the game happening here. So, and I have written an article on that, healthcare for sale, Indian healthcare for sale. So massive consolidation. I would say first, massive investments have come in.
Mm.
So when investments come in, you want to make sure that you have the buying power. So you want to go on a buying spree. The consolidation has been massive. And except for one chain, I guess rest all have got private equity. That's the level we are in. So just imagine a huge country like India, have barring one or two chains, rest all have a private equity, a foreign investor in their,
So
you
it's
know,
not it's foreign and private equity funds more so than Indian.
foreign, yeah, foreign, mostly foreign. And shocking was a recent acquisition, which was, many times multiple of EBITDA, which doesn't justify any amount of revenue these guys would do. Now that is a red flag for me. That what is the end game? So I'm okay as long as they invest for innovation, group buying, it's fantastic. I mean, no problem. But if you're going to buy and to say that I have 15,000 beds, I will do at this price, and you try to harm this the government. Now that would be a terrible thing to happen. So I do hope that we don't reach a stage, because in 2013, early 14, I had seen an ad in a leading newspaper from those providers, Association of Healthcare Providers of India, putting an ad saying, we are not going to treat CGHS beneficiaries because your consultation rate is low. I was chairing a forum, and the guy was sitting and the health secretary was sitting. I said, this is the last thing I wanted. You have gone the US route. You are artistic the government to say, submit to our rates. But I think that was 11 years ago. Right now, the consolidation that is happening, my belief is that we are going the US way, which for a country like India is not the right path. I can say that.
Yeah, look, we've had examples of good and bad with private equity consolidation in the States. So it's far from a clean linear pathway. But I will say our experience has been, or at least my interpretation of our experience has been that we have moved from a highly fragmented market where independent practices were lean in infrastructure, limited in sophistication, and so there was a cost to the legacy status quo too of this highly fragmented market to now a market that has become increasingly consolidated, where the organizations invest in more sophisticated management. They're better positioned to have data infrastructure to bring transparency to cost to performance. They're better positioned to be a strategic partner to other key stakeholders in the market, whether that's hospital systems, other specialty players, payers. And they're also better positioned to build integrated care programs within their specialty that actually treat the patient holistically and try to keep patients healthy and out of higher cost environments. And so ancillary services for remote monitoring, ambulatory surgery centers that are, in-house instead of going to the hospital for a surgical procedure, you go to this lower cost environment and the list goes on. And so there are plenty of examples where it hasn't worked out exactly perfectly. But when we look at where it has worked, the product in the consolidated market with the investment is far and away better than the legacy environment where there was a high level of fragmentation and low level of sophistication and low level of infrastructure, and far better than the other alternative, which is the higher cost, 100% hospital option. Are you seeing any examples in India where, yes, there's reason for caution, as there always is, but where the investment in the healthcare market is producing a better option when it's done well?
So, Jason, it's a very interesting question, but I think you have to see a legacy system and you have to see what's coming. So let's look at where we are standing today. On one side, you have established players, which are like fortune companies. Other side, you have lean startups. They are disrupting the game. So if I have to weigh on existing legacy system getting more money to become better, to become more, agile and lean, I would say I more prefer startups disrupting the business. And this is where I see uh, the future of companies. And I'll give you an example which I keep quoting every time. Intel was the most powerful computing company in the world. So much so that every computer had the logo Intel inside. And last year, when I gave the presentation, I used to say in the second quarter of 2024, they had a $1.6 billion loss. In the third quarter, they had $16.6 billion loss because they thought they were the biggest and the most valuable company in computing and intelligence. Nonetheless, the founder of Moore's Law was their founder, chairman emeritus. They didn't realize that it is not the monopoly, it is not the power of the billions of dollars, but it is the new system that will change. And what did Sam Altman do? It is history. He just appeared in November of 2022 on the scene. And rest, as you know, is history. So I give this example. While healthcare is fantastic in terms of what we're talking, at a look is that Kaisers of the world, there are the Cardinals of the world, there are Mounts and Eyes of the world. Fantastic. But there are startups, I see them, I work with them. They are getting disruptions that doesn't require these kind of massive investments. That's why I said that the AI model that I developed, the functional AI pyramid, gives me hope that unless these companies look at the Intel pathway, they are going to have a moment of truth and it's not going to be far. I'm not a believer that more money is more healthcare is more health. That's not an equation that, in my eyes, work. I think collaboration is more important than money at this point in time. And AI is going to disrupt the game much more than you and I can imagine.
You mentioned, just back to something you said earlier, that I think 30 to 35 provinces and healthcare is sort of fragmented at the provincial level in India. And then you also mentioned that Prime Minister Modi has taken some strides to create national policy, I think digital and telehealth being one of the key focus areas. With those national policies, I would love to hear a little bit more about what the focus is and how that's going. And has that changed the level of fragmentation across the different provinces? Has that united to sort of a cohesive national strategy?
So, Jason, very interesting question. And the Prime Minister Modi believes in digital. I mean, he believes a lot in asset-light things. And when we put this National Digital Health Mission, it was a statutory body, the National Health Authority. The whole idea is to digitize the healthcare system, the health IDs. The challenge we were having is that individuals were utilizing multiple government schemes. No one had an idea that if I take a claim from your organization, from other organization, I mean, you were ripping the government. I mean, a provincial government and a central government, whatever. So with one ID, you just cut that fraud. We are setting up the claims exchange. Just imagine when that data gets into this, and I look at outcomes as a measure of quality, GCI or the NAPH. we would change the way we look at delivering healthcare. Because I would have data of people, are longitudinal data. I would have, looked at what claims they made, what kind of history. And there is no precedent of such a program. The 25 million health IDs have never been given out in any part of the world. And now I empathize with our CEO of the National Health Authority that he is driving something that has no precedent. It's a tough one. But yes, there is a scope to improve. And I think today we have around 77 million health records linked to these health IDs. The day they become, I would say, 7 billion, we will be able to predict where we need health facility, what kind of people we need, what kind of drugs we need, and that would change. Would it take 5 years, 10 years? I have no idea. I think it depends on the success of our ultimate mission. But we could give an example to the world that how data drives healthcare.
So just to make sure I'm following correctly, so the initiative really was focused on creating a national data record so that whether you're in province 1 or province 35, whether you're at hospital 1 or hospital 2, there's a single repository of national
True.
data for the patient.
That's
And it
right.
sounds like there's 800 million
25 million.
825
Yes.
million IDs have been issued and yet only 77 million records. Why is there such a disparity between number of active users versus the amount of data that's entering this repository?
Yeah. So, I mean, this is something that I've been, trying to get the focus of our people is that to me, we have done commendable work in terms of so many ideas rolled out. But to me, it will be when this gets populated by data, people see value. And also, that when you make it data driven, lot of unscrupulous elements and bad practices of healthcare will go on because everything has a digital footprint. So I think there is initial resistance, I would say. Probably another thing doubled with lack of awareness. But I think once we are able to showcase success story, this is what I've been working with the National Health Authority to say, let's showcase success stories. Once this adoption happens, I think India would be able to give a model to the world to look at how data-driven healthcare is done. And if we apply AI on the top of it, we would have done phenomenally well at much lower cost.
Is India mostly on EMRs today, or is there a large portion of the
Yeah.
population that's on paper records?
Short answer, no, we are
No,
not.
no, no.
Not, that's right. Yeah. Yes. Yes. But that requires, I think, a bottom up approach of patients asking for it. I think the value has to be, and I think this is where people like you have a big role. Well, for you, it's a podcast for people in healthcare. But a lot of people who watch, and get a sense of what more we need to do, organization, government officials, they go back and get these provocative ideas to say, hey, I think we can do more. If my ideas get populated with data and if you're able to showcase the outcomes, patient will lap onto that. So I always look at you all being leaders, the voice of millions, who would watch these things, find ways to say, okay, I think I don't have it. I should to explore more. So I think we all have to do a lot of heavy lifting for people to understand the importance of health
Yeah.
IDs
Look, I mean,
populated with data.
it's not an accident that the wave of private equity consolidation occurred, I don't know, about a decade after a wave of EMR adoption, where we had meaningful use that really promoted the conversion from paper to digital records and provided incentives and mandates to do that. And so with that came, increased investment requirements, increased administrative cost to running the practice on an ongoing basis. And then, 10 years later, you get, and I'm oversimplifying. I think there are many variables that were at play here, but one of them was, as a small independent practice, the cost and burden and complexity of running my business is too high. I need to consolidate in order to have, be able to support the infrastructure that's required to run my business. And so one thing contributed to the other. And so, as India looks to get to this national data repository, which I imagine will be benefited from having digital records. It sounds like it's going to be hard to do that on paper records. I think you could expect that the cost and burden to run these businesses could increase, which may require some level of investment, which may require some level of consolidation in order to get to that outcome. Curious if you see that, or if you think that there'll be other alternatives that don't require consolidation to get from paper to digital to national data repository.
So Jason, my understanding is a little different, is that a lot of people have not experienced what technology can do. Once you experience that, you don't need an incentive or a disincentive.
Mm.
Technology does a very interesting thing for people. It moves from one to one to one to many. Whether you're a clinician, whether you're a doctor, whether you're a patient, technology makes life much easier. But I think the shift lies in experiencing that. How can we do that is going to be a big challenge, but there is there is no doubt in my mind that everyone will have to shift towards it. Government has the biggest push. I think insurers will drive a bigger change. I think more than government, it's the insurers, that the payers that do this. I mean, like, just imagine 550 million people covered with insurance. How on earth I will do claims approval, payment, and readmissions without being digital? So I think there is a different way of our approaching this issue. On one side, we're saying if you have an insurance, okay, insurance companies will take. And we're mandating that approval has to be digital. It has to go through health claims exchange. So my belief is government has done its bit of giving that framework, putting the policy in place, ecosystem, a body under an act of parliament to let health IDs, e-consultation. And now that insurance is getting in, insurance will do more consolidation in terms of technology upgradation than this private equity. And you will see that. And that's not just India, anywhere. I mean, if I'm paying, I need accountability.
So maybe let's move from India focus back to the global perspective. So you have been, again, like I said, involved at the World Health Organization, at the United Nations, from a healthcare policy perspective, from a digital health perspective, and you're a frequent speaker and traveler. I think today you're in India, but last week you were in Colombia, and next week you're going to be in Germany. And so you've had a unique vantage point to be able to understand what's going on within digital health within these different countries, make comparisons. And I'm wondering your perspective on any best practice that stands out, either, cohesive national strategies that strike you as pretty well structured, or just different initiatives or anecdotes of what's working well as you've had a chance to compare and contrast different countries' digital health strategies and programs.
So yeah, very interesting question. And I will fall back on two examples. One is digital, one is conventional. So the most respected health system in my view is none of them from the West. It's actually Sri Lanka. Of
Sri
course, over
Lanka.
the years, it may have deteriorated over the last few years with whatever reasons. But when I studied all the world's health system for my first book, I realized very carefully, almost like 7, 8 decades back, they created a hospital-backed health system. If I remember the numbers correctly, at around 3.5% spend on health as a portion of GDP, their indicators were better than many European nations because it was a hospital-backed health system. And I don't know why the world has not spoken about Sri Lankan health system as it was at that point in time. I don't know about the last 5, 6 years. That's one. So on conventional health system, Sri Lanka to me stands out. I mean,
What
it will
when you
always
got under
stand.
the hood in Sri Lanka 5, 6 years ago, what was it that they were doing that led to such favorable outcomes at such a low cost? What was the structure that allowed them to achieve that?
So it is a hospital-based system. So everything finally falls on the hospital. So you don't have to run from a GP to others. It's just hospital-based. So you are at the right place. So I think that's a very interesting model to study. That is the conventional one. And the one thing that I was very intrigued with was that the UN IGF hosted a meeting in Riyadh 2 years ago. And while I was there, their IT minister came and said, "Why don't you visit our virtual hospital?" I think that, always the impression is that when people say virtual, they actually don't understand what is virtual. But since he organized the trip, I went and I was shocked. A huge hospital, not hospital, actually a building with 200 specialists and not a single patient. I said, "I don't see a patient." He said, "Yes, we serve patients across Riyadh, across Saudi Arabia." And I think that is something that impresses upon me that if I look at one side, the Sri Lanka model of the conventional hospital based systems, and I look at the virtual hospital in Riyadh in Saudi Arabia, I see something at the intersection of both, which to me appears to be the future of health systems, where you should not be dependent on going to a facility. I mean, in fact, my vision that shaped after so many years is that if you have access to internet, you should have access to health. Very simple as that, and AI will make it happen. So I think two things stand out for me. I mean, otherwise, if you ask, I mean, I had a keynote where I compared 11 health systems and I spoke at the National University of Singapore. NHS has the best coverage. France had the best outcomes. US has the best expenses. So all were number one, but they were number one in all different manners, but not in terms of the, I would say holistic manner where their expense to outcomes were matched. So I compared 11 systems and I realized that healthcare does not have a system.
So you like the one-stop shop nature of the Sri Lankan system, and then you like the virtual aspect of what you saw in Riyadh.
Yes,
And you
both
like
at
the consolidated data strategy that India is pursuing across its country. notwithstanding the complexities to get there.
Yeah, Jason, and this is what has led me. We hosted a big session 2 months ago on, is the healthcare system broken? Can digital health fix it? And my hypothesis is that if there's a broken health system, if you keep putting more money and resources, you create a bigger broken health system. That's all. I mean, you don't fix the problem. You just create a broken bigger. So what we did, we set up a 12-member commission called the Century for 21st Commission for 21st Century Healthcare System. So we have roped in the president of FIP, ICN, EFMI, we're calling president of the head of OECD for health. We are getting to relook at health systems with the latest advancements. Last 300 years is done well. We are living longer. We are doing better in terms of having cure to diseases, but we still have an 18th century system treating a 21st century patient. So we got to relook at that. So my entire experience is taking back to the basics to say, let's redesign a new health system with what will deliver. With so many technologies in place, so many advancements, we are still treating the phenotype, not the phenotype plus genotype. So I think we have to go back, look at what next, what the new system should look like. And I think I'm very excited that in the next 2 years, we should come out with a model and probably implement in the country and test it out.
How about in India? When you compare your experience in Riyadh, do you see examples of anything comparable in India?
Yeah, a better one. I said e-Sanjeevani is something that does 300,000, 400,000 consultations in a day. If you have a mobile phone, just pick the phone, dial up, you're connected to a doctor. It's free of cost, funded by the government. So I think, yeah, we did that. We also have innovators like SSI Innovations that have their own robotics. So we are doing surgeries hundreds of miles away without any doctor out there. So there are a lot of innovations happening. So when you say that it's more PE money that gets you there, I think it's more startups with better ideas that will disrupt this entire ecosystem of healthcare.
If you were to project who the winners will be in healthcare 10 to 15 years from now, and you were to think about what those players look like today, they have a certain type of reimbursement program, public versus private. They have a certain type of data infrastructure. They have a certain type of usage of hospital versus non-hospital. So today they have certain foundation, and that foundation is setting them up to win in healthcare in the future, to be the best in healthcare in the future. What do you think that foundation looks like today? Do you have any examples of countries that you think are well positioned? It sounds like Saudi Arabia, but other countries that are well positioned for success if you were to project out 10 to 15 years from now?
So, Jason, you threw a question and we worked on something very interesting. I don't have the answer, but what we are building is a model. So I take the example of Edison and Tesla. Both invented electricity. Tesla died a pauper in the hotel, not able to pay bills. Edison got the credit for what he built. Both were individually brilliant. Edison had the ecosystem. Tesla didn't have the ecosystem. So what we created is now the Tesla Edison ecosystem to shape the thinkers who will create what you're asking. It cannot be done by me predicting. I'm not an astrologer, not at all a healthcare astrologer. But I can tell you, none of the big companies will survive. They will be like the tech graveyard of the Nokias, of the Blackberries, and the others. Because the disruption that is happening, when I see that, I'm enthused that we will get there and none of these big companies will get it right because they are only focused on share market or market share. And none of this give you a solution because you are looking health in dollars. Healthcare is not looked in terms of outcome and health and people. So the shift in the thinking is not going to be happening with $9.9 trillion being spent on healthcare. 1/10 of the global GDP goes on health. Look at the indices. So I think it will be exciting. It will not be 15 years. It could be 10 years. I'm not saying it will be Saudi Arabia or India or US. It could be Africa. I have no idea. One who has the most challenges and the least of money will be the one who will win, not the other way around.
Yeah, we see that. I've had a chance to speak with different entrepreneurs in different countries, and it is interesting how challenges faced with limited resources leads to a lot of creative solutions. So I think there's a lot of merit to what you just said. I would agree with that. I think that's a good place for us to wrap up. Rajendra, I really want to thank you for your time and your insights, both on the Indian healthcare market as well as the global healthcare market. Thank you so much for being a guest on the podcast.
And Jason, it's lovely to be with you.
I look forward to it.
Thank you.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.